bunch of Wall Street billionaires. It's terrible. They are riding around in 200-foot yachts. They're riding around in private planes from last year, old models. So, and only 65% of you out there are taking care of these people. We need the other 35% to step up, because we can't have our Wall Street millionaires go to the French Riviera last year with, a 200-foot yacht. They have to upgrade. So we have to help them upgrade. How are we going to help them upgrade? Well, for the Wall Street billionaires that own the Medicare Advantage plans, don't do nothing. That's what they want on their Christmas wish list this year, is for you to do nothing. Don't check your plan, because what we see happening is there is a large company out there, you know the name, has already said they're going to cancel 600,000 plans, over 600,000 plans. And a lot of the other ones followed suit because they're trying to save money. They need that yacht. Come on, people, let's pony up here. This is your hard-earned money. And they need that new G4, G6, G8, whatever it is. And they are cutting costs. They are getting less from the government, so they're going to be cutting costs. With the big beautiful bill, they see the writing on the wall that there's going to be cuts in the future, so they need to make you pay more. They've got a bunch of lawsuits that they're fighting for doing things like, denying people's coverage through prior authorization, using artificial intelligence to deny people. So they've got a lot of lawsuits there. You need to pay for that. Come on, people. The networks, one of the reasons they're canceling these million plans or so is because of these PPOs. So if you have a PPO, you really, really, really need to pay attention this season. You're going to be getting an ANOC letter, the annual notice of change letter, in the next few weeks, and it'll tell you all the details about your plan next year. And these plans, they were designed by these Medicare Advantage, these billionaire companies, and they're like, hey, we've got all this, we've got these extra costs, they've got the lawsuits, we need more fun toys and stuff, so we need to put the screws to people, and we need to cut as many plans as we possibly can that are not making us tons of money. And these PPO plans, they don't make as much money on those PPO plans because you have a lot more leverage. You have a lot more ability to go see doctors you want. They don't want that. They want you to see their doctors they negotiated with. And then I'm sure if you've already seen, if you're checking out on social media, a lot of doctors are complaining about these companies, about the fact that they're denying things and they're reducing, how much the doctors are being paid, how much hospitals are being paid. A lot of hospitals and doctors are just saying, forget about it, pay cash, or if you have any other type of private insurance through an employer or something like that. But if you have, Medicaid, no. If you have a Medicare Advantage, no. So a lot of doctors and hospitals are out there are dropping these. So in your plan that comes out, if you have a Medicare Advantage Part D plan, 65% of people out there don't check. They just let it ride. And that's exactly what these companies want you to do. They want you to let it ride. And a lot of people don't realize that. They say, well, I love my doctor. Okay, cool, perfect, awesome. You love your doctor. I love my company. They've always treated me right. Great, perfect. Keep that same company. But that same company that you had, they probably have 3, 4, 5, 6, 7, 10 different plans in your particular area. And they're probably going to come up with a new plan for 2026. So you can keep your doctor, keep your same company if you like that company. You just pick a different plan in that particular company, because what they do is they say, okay, there's a certain amount of people, 65%, that don't check. So we will just keep diminishing those. So you look at your plan and you say, okay, and what do you mean? It's zero premium. So zero premium can't get better than zero premium. No, it's these billionaire companies are a little bit smarter than that. It's in the details. So this year, last year, whenever, if you ever got into have to go to the hospital, you might pay $50 a night in the hospital. Next year might be 100, 150. You need to check. Specialists this year, $0 to go see a specialist. Next year, maybe $35, maybe $50. If you need to go to an x-ray, maybe $0 this year. Next year, $50, $100, $200. That gym membership you liked? Yeah, no more. The dental you liked? Yeah, possibly no more. So these companies with all of these strains in the industry, the lawsuits, the government cutting back on all of these, the doctors kind of bailing ship, and the fact that, they have to keep up with the other billionaire Joneses at the French Riviera, they are cutting back plans throughout the country. And if you just let it ride, then you're just basically saying, okay, whatever these billionaire people that designed my Medicare Advantage, I trust them. I know they have my best interests in mind, so I'll just go ahead and let it ride and I won't check. So it's important that you check. Long story short, please check your Medicare Advantage plan, particularly if you have a PPO. If you have a PPO, you really need to make sure, and this is a good thing. People that are canceled, a lot of people in my community are like, please cancel me. If your plan is canceled, your Medicare Advantage plan is canceled, in that cancellation letter, it'll have verbiage down there, a paragraph that says, okay, we canceled you, we decided to leave your community, we decided to drop your PPO, we decided to whatever, but you're canceled. So we're not going to automatically renew you for next year. And because of that, you will have a guaranteed issue right to where you can go back to original Medicare Part A and Part B, and get a Medicare supplement plan. So if you've checked out a Medicare supplement plan and you've determined, usually it's based on a budget type issue, that you just can't, the monthly premium for a Medicare supplement plan is just not in your budget, check again. See if it's still not in your budget, then it's not in your budget. Then you just go ahead and try to find the best Medicare Advantage plan in your particular area. But you do have to switch. If you're canceled, that means that it doesn't automatically renew. You have to find another plan, either a Medicare supplement plan with a prescription drug plan added in, or a Medicare Advantage plan, which those have prescription drugs. Most of those have Medicare prescription drug plans already put in there. So I'm going to have the people that we recommend. So if whoever signed you up, if it's a high school buddy or whoever, your niece or nephew that helped you with your Medicare Advantage plan, make sure you reach out to them and say, hey, when the new plans come out October 1st, let's go through it and see exactly. If you don't get that annual notice of change, they'll be able to go online and look at your particular plan and help you out. If you need help, you can also reach out to our partners there at Chapter, and they can help you out 100% for free, and find the best plan. You can't change your plan. You can. The new plans come out October 1st, but you can't change your plan until October 15th. And I think this is probably going to be the busiest. I said that last year, but this year is going to be even worse. Last year was because of the big changes in the prescription drug plan. It went from $8,000 to $2,000 deductible. So there was big issues last year, but this year is it's gonna be far, far crazier. So you have between October 15th and December 7th. So if you can't get in on October 15th, don't worry about it. You've got till December 7th to change your plan. And your new plan won't take effect until January 1st. So you've got that time to do it. So it's not a super, super rush, but you have to make sure you do it by December 7th. Again, if you call Chapter the first week, it's going to be tough, but give them a call and they'll definitely call you back. And please don't wait till that last week, the annual meeting of the Procrastinators Club, as I call it, or as my second name for Valentine's Day. All the guys out there know what I'm talking about there. Okay, so please, and I'm going to have Ari from Chapter here tomorrow. We're going to be talking about the annual notice of change and some other crazy stuff going on in the Medicare world. Remember, all of this is your money. That's the key thing. None of these companies are giving you this, dental and vision and gym membership and all this Medicare, the healthcare and stuff out of the goodness of their heart necessarily. If you want to believe that, fine. But this is money you paid for. The Part A, the hospital type stuff, you paid for that out of your FICA tax, all those decades. So, and then the $185 you pay for Part B, all of that money goes to Washington. And then when you sign up for a Medicare Advantage plan, the CEO or whoever takes their begging bowl to Washington and say, hey, I just signed up Rosemary or Bella or Nancy or Janet, and give us that person's money. And then the government gives over a certain percentage every year to that Medicare Advantage company. So that is your money. You are just getting it back. You paid into it. You can either give it to the CEOs and the board of directors and the shareholders of those billion-dollar companies, and so they can go buy a new yacht and a new jet, or you can keep it yourself. So unfortunately, 65% decided to give their hard-earned money over, to buy a bigger yacht. So if you ever see that big yacht dock someplace, jump on it. You probably paid for it. Yeah. Anyway. All right. So let's go ahead and get into some live questions here. Joseph, you still have not answered my question yet. Okay. I've answered quite a few of your questions, Joseph. I think you asked about 4 or 5 questions over the last few weeks. But I get hundreds of questions that fly through the screen here, and so I just push buttons, and whichever question pops up, it's kind of unfortunate. It's the luck of the draw. Sorry about that. They want that house in London and that house in France and one there in the U.S. and another jet plane. They can't go without their shrimp and their lobster. Oh, bless their little hearts. Yes, yes. And yep. And I mean, and now we're doing it with the tariffs, because that is a sales tax. You know, they have admitted. I played a segment on Fox News where the people said, oh, yeah, this is a national sales tax. Yeah. So we are paying even more. So I can go out of network, but if the hospital don't take it, you can't go. Yeah, that's, some people talk about Medicare supplements like that, you know, because I always say, you know, when you get a Medicare supplement, you keep original Medicare Part A and Part B, and you get a Medicare supplement plan, you know, one of the Plan Gs or the Plan N or whatever like that. And there's no networks. You can go to any hospital, clinic, doctor in the country that takes Medicare. And people say, well, I went to this place and they wouldn't take it. Well, it's usually the situation. If they take Medicare, they'll take it. But usually it's like, oh, that doctor just is not accepting new patients. Well, yeah, you can't get around that. That has nothing to do with insurance. That doctor just, you know, realizes, which is a good thing. You know, if the doctor says, hey, I just want to take care of my current patients, I don't want to add any more and, you know, put myself thin. I want to take care of the people I have now. I would argue that's a good doctor. So unless they're just lazy and they don't want to see anybody. And so anyway, company names, I try to avoid this. Medical Hut, so they can hire their own doctors so they can't complain. Yeah, that's what we see a lot of these companies. They are, you know, going within the network and they're paying, you know, doctors. You see a lot on social media, the doctors, they're finally speaking up. They're saying, hey, you know, it's always been an issue with, you know, hey, we want this particular patient to get this test or do this operation or something like that. And they have to jump through all kinds of hoops. And they always had an issue with that. And now they're just nickel and diming these poor doctors, particularly rural doctors, because, you know, they have no other option. And it's the race to the bottom. I remember watching a documentary about a billionaire who wanted to buy the moon just so he could look up every night and say, I own that. Yes. Wow. Let's see here. The insurance customer was telling me information that nobody told them what was going on after October 31st. Insurance customers. Yeah, there's a lot going on. I'm not sure what we're talking about there, but yeah, there's a lot going on with the big beautiful bill, and it does affect Medicare. The big beautiful bill is going to cut Medicare. A lot of people don't realize that, and what it is that anytime a bill, a law passes Congress and it creates a deficit, there is a law that goes into effect. It's called the pay-go, the pay-go law. It's been around for about 15 years or so. And it basically says, okay, Congress, you're not supposed to be, you know, passing stuff that cause deficit. We already have, what, $37 trillion of deficit. You can't do that. So if you pass a law that creates more debt, then you have to offset it in another place automatically. And Congress can write in the law that they passed that it suspends that, but they didn't this time because they didn't want to. So what happens is they have to cut somewhere else. And Social Security in this law is off the table. They can't cut Social Security because Social Security is a completely different standalone budget. They can't cut the Department of Defense, Veteran Affairs type stuff. So the other biggest place they can cut is Medicare. So that is where they're going to cut. And those cuts are starting almost immediately this year. And who's in charge of that? Russell Vought, the Office of Management of Budget, one of the prime architects of Project 2025. And he's always wanted to cut Medicare. And so that's exactly what he's going to do. So we're looking at about $535 billion of cuts into Medicare. So all of that is going to trickle down to these Medicare Advantage plans, original Medicare, prescription drug care, all the rest of it. So it's it's unfortunate, but you just have to do what's right for you and your family. That is, check your particular plan and make sure you have the best one in your particular area, because they're all different based on the different areas. So, and just don't think, you had your Medicare Advantage was, the brand new Mustang or Corvette. And January 1st, you just might walk out to your driveway and find out that that brand new Mustang turned into a 1972 Pinto. So, sorry, aficionados of 1972 Pintos. This is so confusing. I will be 65 at the end of the year. However, I am so lost as what to do. I have been a housewife for 31 years. So if you have health insurance from your current spouse's work, and your spouse is currently working, receiving that health insurance, and you have 20, if that person has 20 more employees in that company, then you don't have to sign up for Medicare Part A or Part B or anything like that. If you don't, then you're going to have to. If you're already receiving monthly benefits from Social Security, they'll sign you up automatically for Part A and Part B. But considering it's September, or if you're already receiving Social Security benefits, you'll get your Medicare card probably this month, and then you'll have to find something to cover the gaps, because the problem is that original Medicare is awesome. It's not the best. We could do a lot of improvements on there. Bella says, good, Ario's coming. Yeah, he'll be here tomorrow, so he's always great to have. But original Medicare has a bunch of gaps. The big one is this co-insurance that you have to pay. If you go to do an operation that costs $100,000, that means you have to pay $20,000 out of pocket. So that's why either people get a Medicare supplement plan, also called a Medigap plan, or a Medicare Advantage plan to cover all of those gaps. I always recommend checking out a Medicare supplement plan first, one of the Plan N or the Plan G, but check it out, all of it, whatever is good for your particular budget and your situation. So you can call Chapter and they can help you 100% for free. So Brenda, because of the insurance merry-go-round, I have and will continue to keep traditional Medicare. Perfect. 84 among can't afford to otherwise, whether F or G, it's better, but my Plan D now $50. Help. Wow, $50 for your Plan D prescription drug one? Yeah, I would definitely make sure you review your plan. Yeah, so I would definitely. My plan at least is whittling away its services. I'm looking for something else, Delta Dental. Chapter and I are on the same page on this. Vision insurance, dental insurance, not a big fan of. But if you're going to do it, you go to your dentist and say, hey, I'm thinking about getting dental insurance. And the dentist says, I know what your teeth are looking like. You don't need dental insurance. You just need cleanings every now and then, so don't waste your money on it. Or if they say, yeah, that might be a good idea because we've got some stuff and you might have some issues next year or 2 years from now and stuff like that. So it might be a good idea to go ahead and get something now, because most of the time when you get dental insurance for the first year or two, pretty much nothing is covered other than like cleanings and very minimal other stuff. So you have to have it a while for it to start covering stuff. So just go to your dentist and say, do I even need dental insurance? And usually they would say, no, you just pay cash out of pocket and save yourself some money. Or if there's issues, then they'll tell you, and then they'll say, and this is the insurance I take. This is the insurance I recommend. So that's the best way to do it. I saw someone talking about how they're going to limit how much we can keep in our bank account if we're on Social Security, and that limit was $400. Is this true? No, that's not true. The person was conflating SSI with regular Social Security. And SSI is supplemental security income. It's a welfare-based program. It's not regular Social Security, retirement, disability, survivor benefits, spouse benefits. It's SSI, supplemental security income, welfare-based, started in 1974. And pretty much for decades, if you apply for SSI, the welfare-based program, you give Social Security permission to check your, financial situation and your bank account and all that kind of stuff. So if they have access to your bank account and the computer system checks every now and then, and if it gets an alert from your bank that, you've got, $100,000 just deposited in there, then they're going to stop that welfare-based benefit. So they've had that access forever. They just changed the parameters recently. Before it was like, if it's over $400, they didn't mess with it. But then they said, well, just go ahead and, we can check everybody's. So that's it. It's just SSI. So it's been happening for decades. Not a big issue. And the thing is, if you're on SSI and you say, well, I don't want them to check my financial records on a regular basis, then they will deny your SSI. So you have to do it. Same thing with Medicaid, with your state, food stamps and stuff like that, Section 8 housing. You give, the government, in order to receive those benefits, you give them certain access to monitor to make sure you don't get overpaid. So, Layla, I am not in an Advantage plan. I have just Medicare. Are they going to force me into an Advantage plan? Good question. Dr. Oz, who's in charge of this Center for Medicare and Medicaid Services, he's always been a big fan of Medicare Advantage. So there is a proposal out there to do just that. That when you turn 65 years old, they automatically put you in the cheapest Medicare Advantage plan. Instead of, just a, Medicare Part A, Part B, they put you in a Medicare Advantage plan. But we are going to make sure that doesn't happen, right? So, Canada provides universal health coverage for essential medical services only, with notable gaps in coverage for other health-related services. Private insurance is needed. 70%. Yeah. There's a lot of, America has great health care. If you can afford it, great health care. Access to that health care, not so much. So there's a lot of countries out there that we can say, okay, this is a good system here, that's a good system there. Bring it all together, and we can make a pretty awesome system if we really wanted to. But we are not in charge. It's the billionaires on Wall Street that decide all this, because we are too distracted with distractions the politicians put up. Okay, if you retire with FEHB, that's Federal Employee Health Benefits, recommend signing up for Part A and Part B. Part A is no premium for most. Yeah, and if you work for the post office, they make you sign up for Part A, Part B. If you receive your Social Security benefits, you automatically get Part A. You don't necessarily have to get Part B, but you can if you want. So in your case, sounds like it was a good thing to do, but yeah, everybody needs to check. If you're in TRICARE, retired military, then you have to get it. They are messing with the most needy people. You can't convince me they can't find other programs they can cut. Yeah, I know a good program they can cut, or at least find a lot of fraud, waste, and abuse, and that's Department of Defense. The Department of Defense hasn't passed an audit in decades. They failed every single audit they've done, except for one branch of the DoD. United States Marine Corps, hoorah, they passed their audit last year for the first time. So the rest of you services need to go out there and, do your books. Let's see. I love Dr. Ed. He makes me laugh. I needed to. Thank you. Yes. Yeah. I was trying to figure out what type of good spin to put on the front of it to kind of drive it home. And it's like, oh, if you're receiving a PPO, you're going to be canceled and stuff. But I think the interesting thing of 65% people love their billionaires, and they just let it ride. And they love giving their hard-earned money to billionaires. If they have saved so much in imposing tariffs, why do they need to take our money? Because they need a bigger yacht and faster jets. So, and that's why, Medicaid and Medicare and all the rest of it, the people that can't afford this are gonna pay. So all the tax breaks for the billionaires and the millionaires, on the big beautiful bill. And politicians think that's a beautiful thing. What part of Social Security is going to get cut first? SSI, SSDI, or regular Social Security? Actually, technically not SSI, because when we're talking about the cuts, and for you new viewers out there, you got 88 more checks as your current check. You're going to get 100% of your current check for 88 more times. And then after that, it's going to be cut by 23%. And this is Social Security Trustees report that says this. I've got the link in my description, so you can go there and you can see exactly what the Social Security Trustees report did in terms of the calculations of this. But which one is going to cut first? It's across the board, except for SSI. Because SSI, Supplemental Security Income, the welfare-based program, is not paid out of the Social Security Trust Fund. Everything else is. Social Security retirement, Social Security disability insurance, survivor benefits, spouse benefits, child benefits, disabled adult child benefits, all of that is paid out of the general trust fund, the Social Security Trust Fund. And it'll all be cut. That's the law. As of right now, that is the law. Social Security can only pay what it has. And right now, technically, it can only pay about 90% because that's how much it has coming in every year from FICA taxes. The other 10% comes from the Social Security Trust Fund, AKA our savings that we put away in the trust fund. So people say, oh, the Social Security Trust Fund was stolen. No, if you think it's stolen, if you think it's fake money, take 10% of your Social Security check and please give it to charity. If you don't think that's real money, then other people will do. So I was at a dentist today. My insurance saved me a lot. Perfect. Awesome. So in your particular situation, it was a good thing. So yeah, talk to your dentist, and then, Pink Owl, if you had a whole bunch of stuff done and your dentist covered it or your insurance covered it, it doesn't hurt to, check and say, okay, doc, we've done a bunch of stuff. Dental insurance really helped out and stuff, but going forward, what do you think? Should I still continue to pay, $10, $20, $30 a month for this dental insurance? Or do you think all my issues are solved and now I just need cleanings going forward? So yeah, it doesn't hurt. Yeah. My son is disabled. Let's see. And on SSI disability, not SSDI. Okay. If my wife inherits money from a family member that passes, would it affect his eligibility even though it's not actual income? Yes, because any type of income or resources into the household, it really depends, if he's living on his own or however that works out. But yeah, if he's part of that family unit, then you need to make sure you contact Social Security and say, hey, got this money, and here's the deal. And there's certain things, spend downs and all kinds of different stuff, but it really depends how much it is and if he is part of the family unit. So you definitely should reach out, because what will happen is, you have to do those recertifications. And if you're on SSI, you do recertification once every, 6 months or a year or something like that. And then when you do it, this year or next year or whenever they ask you those questions and then that comes up, then there might be an issue where now he was overpaid for the last 6 months or a year. And if he's receiving Medicaid, because he's receiving Medicaid because he's receiving SSI, and then the SSI is terminated for X amount of months, your state might say, hey, you have to pay back that Medicaid money. Usually they don't in those situations. But it's always good. It's always good to just fess up. So you tear that Band-Aid off now so you don't have to deal with stuff, nasty stuff later. So sent Medicaid letter today. They have not responded to calls made, so waiting. So yeah, we're coming up with a new plan of attack for dealing with Medicaid and all that. So we're still working on that one. I had to cancel a doctor's appointment today again because I live on the road and cannot wait around for a month for the appointments. We don't have health care. We have insurance, Cam. Yeah, yeah. So make sure you keep those appointments. If you've got an issue, yeah, you hear all the time in the news. Oh, I just thought that it's something small. That's the thing about getting old. Your body looks old, it feels old, but your mind, you're still, I don't know if you're like me, but I'm still in high school mentally, so, in a lot of respects. So still got that old Marine Corps. Just, I'll just walk it off. I'll just forget about it. And then, yeah, then it's too late. So keep those appointments. I had $7,000 dental for anything last. Everyone used the full 7,000. They took a loss, was not offered this year. I couldn't use a dime of it due to in my maxillary. Okay, long story. Yeah, sounds like a long story. And the good point there. Thank you. That even if you get the best Medicare Advantage plan or the best health insurance or anything, and if you don't use it, then you're just throwing money away again. So that's another way to, stop those, billionaires from upgrading their jets is this, this season, October 15th and December 7th, you find the best Medicare Advantage plan for you that, keeps your doctors and, saves you money on prescriptions and all this kind of stuff, and maybe has some dental in there as well. And then if you don't use the dental by December 31st, it goes away. You've lost that money forever. So when you gave it, you donated it to the people that own these companies. So if you're good with the donation, then you're good with the donation. But I would recommend, if they're going to give you gym membership, use it past the first week in January. Continue to use it, dental, vision, hearing, go get your glasses, get your ears checked, all that kind of stuff. Because if you go out there and do the right thing and get the best plan for you and you don't use it, then yeah. We don't want you to use the medical part of it. We don't want you to get sick or, injured or anything like that. If you don't use that, that's okay. Use the preventative maintenance type stuff. Yes, make sure you go do that, do all your tests and your colonoscopies and all that kind of stuff. And yes, please, please, please. Ed, would you personally do Medicare only or a Medicare Advantage? I would do, if it was me, when it will be me in the future. No, I'm not 85 years old. I'm not Medicare eligible yet, much to the surprise of a lot of people out there, but keep that to yourselves. I am going to pick, because I'm cheap, I am going to do original Medicare with the Medicare Supplement Plan N, as in Nancy, because because I'm cheap like that. So, but if I'm a little bit sicker or something like that, or if I see some issues coming forward, then I'll pick a G. So N or a G. Hopefully N will do me, but if I'm sicker, I'll do a G. Or if I see that I might have issues, I might do a G. Or if I get a good price on a G, I'll do a G. So either one, N or G is fine. But if I didn't have the budget, then Medicare Advantage. And some people say, well, I have a Medicare Advantage. I always had it. It's always been great. Da, da, da. Yes. If you have a crystal ball and you can look into that crystal ball and you can see that you're going to be around with us for another 50 years and you're never going to get really sick or injured or anything like that, 100% get a Medicare Advantage plan. 100%. No ifs, ands, or buts. Zero premium, so you're not wasting all that money on a Medicare supplement plan, the $100 or $80, $120 a month for a Medicare supplement plan, because you're not going to need it, because you're not going to get sick or injured or anything like that. So why waste $100 or, on average a month for the next 50 years? And then please let us use that crystal ball, because we don't have it. That scares me, what you just showed us, because when those two cuts hit, it will leave me with approximately $700 per month. Exactly. Yes. And the reason is because these guys haven't done anything in 40 years to fix this. And we haven't forced them to fix it in 40 years. That's the issue. Because they're really, really good at distracting us. And a lot of people out there buy the distractions, hook, line, and sinker every single day. Drawing survivor benefits off ex-spouse with child under 16 once the child turns 16, do the child lose, do I lose my benefit payment once the child turns 16, but they keep theirs at 60? If I'm not remarried, can they reply? Yes. Okay. So you are receiving survivor child in care benefits. So the child is receiving benefits and you're receiving child in care benefits, and you'll continue to receive those until the child turns 16 years old. Correct. Or unless the child is became disabled before the age of 22. If Social Security determines that child became disabled before the age of 22, the child's benefits will continue. And if you're taking care of that child, the child in care qualifier, then you'll receive benefits forever as well, as long as the child receives benefits. But yes, child in care benefits stop at 16. But and if you're not remarried at 60, yes, you can. Yep. And the previous time you receive those Social Security benefits won't affect your benefits later. It's not going to be reduced because you receive child and care benefits for a year or 2 years or 3 years or anything like that. No effect at all on what you're going to receive. Well, I take that back. The only thing it will affect is maybe the day you get paid, because you were receiving benefits at one time. Usually the pay date is different. So they copy the pay date from the previous period of entitlement. So that's the only thing. But everything, the money and everything will be exactly the same. So again, why do you hate Trump so much? I don't. If anybody comes up and saves Social Security and does the right thing to protect Social Security and make sure we don't get cuts in the future, then I complained about Biden. He passed the Social Security Fairness Act, which was not fair, that did not protect Social Security, did not expand Social Security. That it was actually a detriment to Social Security. So if any politician says the right thing, I'm a one-trick pony. I'm all about protecting Social Security, Medicare, and Medicaid. So I will be getting husband Social Security widow. Will I lose it? No. Well, if you get remarried or something like that. But in terms of the budget cuts, another thing politicians do is they say Social Security is going bankrupt. No, it's not going bankrupt. Will your check be cut in the future? Yes, if they don't do anything. But that's different. So Social Security will be around here for hundreds of years unless we decide to close it down and give it over to the Wall Street billionaires. But if we decide just to keep Social Security as it's been since 1935, it's going to be around here for hundreds of years. The problem is how much you're going to get. Right now, you're getting 100% what you're eligible for. But when the trust fund runs out, if politicians don't do something, then Social Security can't. There is no savings. There is no cupboard to go to give you that extra. So you're going to get cut by 23%. You're still going to get the remainder. So Social Security is still going to pay checks to everybody. It's just going to be cut by 23%. So 4 chapter is going to have its hands full next year. That is a fact. Yes, or this year actually. Yeah. Oh, and yeah, this year definitely, and next year, and yeah, it's going to get worse because that's when the cuts start happening. So yeah, it's as I've told chapter, and I know they realize it. I wish none of these companies existed. Medicare Advantage, I wish it didn't exist. I wish Medicare Supplement didn't exist. I wish the Part D prescription drug plan didn't exist. I wish all these Medicare agents and companies that harass you by calling you 20 times a day, I wish none of these guys existed. And I told Chapter, I told Ari, and I told the CEO of Chapter, I hope you're unemployed. They'll find other jobs. They're super smart. But how can we do that is that we can just cover all the gaps of original Medicare. There's 6 gaps there, and we just cover those gaps. Add the prescription drug plan in there. I would add vision, dental, and hearing, and then we won't need any private companies to cover up the gaps. And you won't need to talk to anybody to find a private company to give up to give the gaps. So cover the gaps. So, but until that day happens, then the best solution out there is find someone that's going to help you and not charge you anything and do the right thing. And Chapter is the people that I found right now that can help you. Love your channel and passion for us. Thank you. Appreciate it. Question: if only 10% comes from the trust and that is what may be exhausted, why would my check decrease by more than 20%, 10%? Because that's how much comes right now. We've got X amount of people paying into Social Security every year. And then I've got if you look at the Social Security trustees report, this is it. So right there. So for 2024, we had $2.6 trillion in the Social Security Trust Fund. Let me pull this out. And then income coming in, that means people paying FICA taxes, 1.2 trillion people paying FICA taxes into Social Security. And then we also had interest because the trust fund does earn interest. And then we have taxation of benefits. This is going to go away to some extent. You know, people that receive Social Security also pay taxes. That's where it goes. It goes back into the trust fund. So all the money that went out, we were able to cover everything but $103 billion. So we had to pull $103 billion out of our savings to cover your checks. And therefore, when there's less money in there. So fewer people are working and wages are pretty much stagnant. And so how much you pay in Social Security is based on your wages. So more and more. So this year is probably about 10%. Next year it might be 11 or 12%. And then 14, 15% is going to be, and then by the time we hit 2033, then 23% of what you receive is not going to be there. It's a snowball. And we've known about this for 40 years. Yeah. All we need to do is raise the cap on salaries subject to Social Security taxes and make the rich pay. Yep. That is the biggest solution right now. It doesn't cover 100% because we're waiting so long. A few years ago, that would have solved 100% of the issue, and Social Security, no cuts for decades and decades and decades. But every year we wait, the less it helps. And that's what politicians are, that's what they've been planning. They said, well, we'll kick the can down the road until there are no solutions. And then they'll say, yeah, we tried nothing and we're all out of ideas. So let's just go ahead and give it to our buddies on Wall Street. I tell my girls about knowing this info now and they think I'm insane. All right. I have Medicare and TRICARE. Would a Medicare Advantage plan be better than TRICARE? No. Stay away from Medicare Advantage if you have TRICARE. You're good. Your TRICARE is essentially your Medicare supplement plan. So you have original Medicare Part A and Part B, and you have kind of a Medicare supplement plan. And that Medicare supplement plan is called TRICARE. It's not really a Medicare supplement, but it serves the purpose of it. But no, I wouldn't get a Medicare Advantage. Some people do because they want the gym membership and, grocery cards if they're available and some other stuff, but Chapter doesn't recommend them either if you have TRICARE. So the last time you were on, you said you were fighting for the people. Are you still on our side? And is there anything we can do to help? Yes, absolutely. Contact your politicians but before you do, Google their typical BS responses to saying, hey, what are you doing to save Social Security? And if they say, oh, we're looking for the trust fund, I've been looking for it for 10 years. And once I find it, I'll put the money back. Yeah, the trust fund is there. Or they'll say, oh, we're stopping immigrants from receiving Social Security. I did a video on this that came out, I did an edited version of that today, which shows you that that's all BS as well. So before you talk to them or you go to the town hall to ask them that question, make sure you're well prepared for their BS response. And that way you can retort, or you can do, 8 Mile M&M rabbit. And before as part of the question, you can answer their BS rebuttal include that in part of your question, the Social Security trustees show that the money is there, it's not lost or anything like that. And that's a common, thing that you say, which has been proven to be incorrect. And so because of that, what are you actually doing other than trying to distract us? So, and we're also coming up with a new platform to, power in numbers. All we need to do is raise the cap on salary subject to Social Security. Yep, and that's the big one. Ask them about that. And one of the responses to that is, okay, it's not going to solve 100% of the problem. Okay, then all right, that's one of the. It's not going to solve 100%. Yeah, it's because you waited too long. It's still going to solve this year. It's going to solve about 73% of the problem. But they'll say, yeah, it's not going to be 100% of the problem. It's not going to, give you free ice cream and unicorns. Ed's not going to get his hair back. So if all those things don't happen and it's, perfect silver bullet, then we shouldn't even consider it. So making the perfect the enemy of the good. Trump won't step up for the American people, period. He will continue to eliminate people. How far back does Social Security retro on child survivor benefits? Yeah, they can go back quite a while. I'm not sure if, so if the child had a parent that passed away, let's say a year ago or something, and for some reason, somewhere you didn't know about it, Social Security dropped the ball or whatever, I would fight and say, hey, there is a protective filing issue in there. So sometimes they can only go back 6 months. But if the child is approved, go ahead and file and get the survivor benefits and then say, hey, give me the maximum amount. Here is why I didn't contact you. Or I did contact you and y'all didn't pick up the phone or, whatever the case may be. They can go back. We've had cases, 2, 3, 4 years back. If there was a protective filing, so I would fight it and get all the money the child is eligible for. Absolutely. I can't believe regular Medicare is cutting back now 2 in 6 states. I guess I was told correct. So sad. Yes, they're rolling out a tests on 6 states of prior authorization for Medicare for a certain class of procedures. They're saying that, again, politicians nowadays, their new abracadabra is fraud, waste, and abuse. If they say fraud, waste, and abuse, then we let them do whatever they want. So if they say, oh yeah, we're doing this prior authorization because we want to fight fraud, waste, and abuse. Oh, okay, do whatever you want. And that's kind of what they're doing. So if you are on Medicaid and SNAP, you can get a discount for Walmart grocery delivery with Walmart. Perfect. Follow up to my survivor question. If I'm not SSDI, but am 100% permanent and terminal DAV, will I not qualify for disabled pension? Okay. If you are receiving survivor benefits, there is what's called disabled widows benefits. If you're married to that person, so between the ages of 50 and 59, you can get disabled widows benefits. Okay. If that's not the issue, but you can always file for disability on your own record. And so if your benefit on your own record is more, 100% go for it. File. Don't wait because it takes forever to get approved nowadays. Let's see. Should you take Social Security at 62 and still work? It really depends on your particular situation, your health, your genes and longevity. You can work and collect Social Security benefits, but this year that it's limited to $23,400. If you're 62, 63, 64, under your full retirement age, you can work just as long as you stay under $23,400. If you make over $23,400, Social Security holds back $1 for every $2 you go over. So regular Medicare cuts now. Not now, but will when open enrollment for those 6 states. Yeah, the cuts, they're supposed to start October 1st, and the Office of Management and Budget, that guy, he's the guy that decides. So nothing official. I keep checking to see what he decides to cut. So I'm checking on that, but no Medicare cuts officially now have been announced, other than that, they're it's on a lot of these companies like Medicaid and stuff, all of the politicians knew that the stuff they were doing was going to be crazy unpopular. So they waited to institute those after the next midterm election. So if these policies that they had about, lazy 26-year-old gamers living in basements was such an awesome policy, why didn't they start it tomorrow? or next month or January 1st? You know, why did they wait till after the midterm elections? Because they might not be soft. But a lot of the companies are already taking action. In your state, there's probably already hospitals and clinics and doctors groups that have already said that, oh yeah, we see what's going to happen next year and the year after. So we're going to start dropping this and cutting this and, getting rid of the OBGYN and no more 24-hour this. Particularly rural hospitals are really going to get hurt. They are kicking the can down the road. Yeah, and that's always, it's called the boiling frog analogy. If you have it's a bad analogy, but if you have boiling water on the stove and you throw a frog in it, it's going to jump out. If cold water, you put the frog in, slowly turn up the heat, it'll boil right there. So we are the boiling frogs. Zapping the cap will also require employers to pay their matching Social Security tax. More resistance. Yes, absolutely. That is a fact. But they always take that out of, your salary anyway. So one thing Congress needs is term limits. Most of the Congress have been there for ages, and habits they have to cause the fights and stubbornness. Yeah, that was always kind of the intention, back in the founding fathers is. What is different from Plan G or N? Oh, that's a good question. I'll get Ari on here tomorrow, but G covers all of the gaps of original Medicare, except for the Part B deductible, which is the $257. It covers all the others. You still have to pay for your Part B, the $185. The Part B, you still pay for that, and then you pay the annual deductible of $257. Plan N, you have small little copays. You might have up to a $20 copay for an office visit, primary type stuff, and up to a $50 for an emergency room if you're not subsequently admitted to a hospital. And then excess charges. But most doctors and hospitals and a lot of states don't even allow excess charges. So and Plan Ns are usually about 20% cheaper per month. So that's why I like them. Is it true that the FICA cap would only add 48 checks until a benefit reduction? No, it would add a lot more than that. Again, the unlimited cap, there's all kinds of different, between 250,000 or starting at 400,000. No, it would add decades onto it. But less and less and less as we move forward, because, if you make a change to your diet, the day before you pass away, then it's not going to help you. But if you make it 20 or 30 years before, then yeah, it's going to help a lot. That's a terrible analogy, but anyway, I'm sticking with it. All right, I've got some video questions here. Let's see what we got.
Hi, I was married to my first husband for 12 and a half years. He was killed in an accident during our marriage. Since then, I've remarried and been married for about 20 years. Am I able to get benefits from my first husband if I'm ready to apply? I am 62 years old, going to be 63 in January.
No, unfortunately. If you got married before the age of 60, you're no longer eligible for benefits, survivor benefits. So if you get divorced after 60 and then remarried again, some people do that. They play the game. Then you would be eligible. But because you're currently married, then unfortunately, no. You can remarry after 60, but you were married before 60.
Yes, my name is Bill. Good afternoon. And my question is, I'm a 100% service-connected disabled veteran, and I get disability through the government, 100%. But I also filed for, I'm 74 years old, and I filed for, I get Social Security every month. But I was just wondering what I should do about if there's any other things I should be collecting as far as would be benefiting to me other than what I'm doing now. I appreciate some help on that. If you can help me out, I appreciate it. Thank you very
much. Okay. Yeah, I don't think without knowing more about your situation, I don't think there's a whole heck of a lot out there, because SSI, the supplemental security income, you probably making with your, your VA disability and your Social Security, you're making over the $967. Medicaid probably wouldn't help because you're already receiving, with your service-connected disability, you're probably, in TRICARE, or you've got all the VA and stuff. Some people that, I'm not sure if you have TRICARE, stay away from the Medicare Advantage. You don't really need it. If you have just regular VA, and if you're already paying for Part B, there are what's called the Medicare Advantage Part B give back that a lot of veterans get that pays for part of your Part B. I'm interested to see if a lot of those are going to go away for 2026, because again, these companies are trying to, make more money, save more money or whatever. Yeah, but in your particular case, I think with those two sources of income, it probably kicks you out of all the other type of stuff. But make sure you check out my website. It's mygovexpert.com, and you can go in there and the living on Social Security alone, it goes through a bunch of programs, federal programs, healthcare, housing, employment, and stuff like that. It gives you some details on that. Veterans, some information on that. SSDI, you wouldn't be able to get disability because you're after your full retirement age. But there's some information on Medicare that might help you, but sounds like you're probably good in that area. So. All right, let's see what other kind of interesting questions we have here.
Hi, Dr. Ed. My name is Wanda, and I'm from Yonkers, New York. I'm reading everything from so I could go within 2 minutes. I've been working as a temp since July 9th. I didn't know how long this contract position would last, but thus far I've earned way above the income limit. I earned about $10,000. I went to the Social Security office on Thursday to fill out the SSA 795 form to suspend my Social Security benefits. And the next day, I was told by my employer that my contract position was terminated effective immediately. Once I found that out, I immediately went back to the Social Security office to rescind my request to suspend benefits. The Tier 2 CS representative said that I had to fill out another 795 form, which I did. But my concern now is that I received a direct deposit of my Social Security benefit, which is payment for the month of July, which I'm not entitled to since I worked for the entire month of August. I've also asked my rep, should I mail the money back since I'm not entitled to it? And she said no, because Social Security can't take the money back from your checking account. My first question is, should I leave the money in my checking account and wait for Social Security to take the money back? Or should I not wait and just send the money back by certified mail? And also my second question is, now that my job officially ended August the 29th, does this mean that I won't be entitled to any more benefits until October, since October's payment will be payment for the month of September? I know that I won't be entitled to payments in September since that it was for work for August, and I worked the entire month for August. Thank you so much for everything you do for us. Thank you so much, and to your son, and thanks to your wife for sharing. Yeah, she's sharing you with the rest of the world. Take care. Thank you so much.
Okay. Yeah. If you're receiving a regular Social Security retirement benefit, I don't think she said whether she was receiving one. If you're receiving retirement benefits, then you're good. Yeah, $10,000. It's not an issue as long as you stay under $23,400 for the entire year. Then yeah, you didn't have to do anything because you said you made up to $10,000. So if you only made $10,000, then the Social Security employee shouldn't even done anything. And the 795, SSA 795 is just a blank form that Social Security uses for anything. So you can write stuff on a piece of paper and that's considered a 795. So it's just a catch-all form. But if you're receiving disability benefits, and that might be an issue with $10,000. But if you've been receiving disability benefits and this is your first time working, then you have what's called the trial work period, where you can make as much money as you want for 9 months, and it doesn't hurt anything. And then after that 9 months, if you still continue working, then they can stop your disability check. But even then, if you only, made $10,000 this year, unless you worked last year, then that shouldn't be an issue if you just started working this year, because you could have made $1 billion up until, if you started work in January and you stopped work in September, you could have made $1 billion, and they would have continued to send you your Social Security disability insurance. After that, then yeah, they're going to start cutting you off. So if you continue making all that money, but in terms of the check, and so you sent up the 795, and they probably are going to send it to the processing center, which may or may not exist. Elon Musk got rid of a lot of those. And so that takes a while to process through the bureaucracy, if there is even people on the other side to take care of it. And now you've got another one that might delay going in there. So I wouldn't even worry about the checks. As the person said, it looks like those checks you're entitled to. And once that second 795 catches up to the first one, then they'll address everything. And so if you gave money back, which is a nightmare to do, you'd have to go down there and write a money order or something. That's Social Security. Technically, they can take cash, but they hate taking cash because the district manager, like me, would have to take that money immediately to go to the bank and get a money order, a cashier's check, and it was a nightmare. So the Social Security only accepts kind of, credit card, money order, cashier's check type stuff. So, but I since you've canceled that out, I wouldn't even worry about it. And again, if it's Social Security or retirement benefits, you don't have anything to worry about anyway. So there's that. But if it's not, if it's disability, then let us know, and I'll go into more detail on that. But I think I covered that one as well.
Yeah, Ed, how come we can't upload our visa documents as proof of life, for long-term overseas stay? They seem to want to make a phone call. Doesn't work. And also the paper thing. I mean, everybody talked to around here. Just send in the 7162, even it doesn't arrive. Again, 1 out of 3 times I've had it arrive since I started using it. But why can't we just upload it?
Okay, so this is someone, he lives overseas, and when someone receives Social Security benefits and lives overseas, Social Security sends out a letter every now and then and says, hey, are you still out there? Because if you're not, then we want to make sure we stop your check. So it's a proof of life form. So yeah, that's what they require, that form. They can't provide anything else, and maybe they'll. But I did a video on this a few days ago for expats, people living overseas. And I said, hey, they've changed the policy effective a few days ago that you can now call and talk to a Social Security person. And this is where someone in the comment says, no, I did that. And they said they can't help me because that person wasn't a Social Security person. So you call and talk to a Social Security person back in the United States, in one of the 1,200 offices in the United States. Or if it's overseas, you actually have to talk to the Social Security person, the federal benefits unit, the actual Social Security employee. And there's about a dozen. The person that contacted me was in the Philippines. And so there's one person in the Philippines that is actually a Social Security employee. If you call any other consulate or embassy in the country, in the world, and you ask that person, are you a Social Security employee? And if they say no, they'll still answer your Social Security questions because some of them are trained to help with that stuff, but they're not Social Security employees, so they don't know about the new policy and they can't really access that system. So you actually have to talk to in Asia, there's only one person that can help you. So someone said, Ed, you were wrong. I talked to a person, they said they couldn't access that. Yeah, because that person's not a Social Security employee. They are just embassy staff who also have another workload of helping Social Security applications, but they're not a Social Security employee, so they can't help you. So there's that. One last question, then we'll call it a day.
Hello, I am 34 and on Social Security disability for a long-term health condition that will continue to decline for the rest of my life, so I will be on this permanently as of now. My husband is 45, and we have been married for 11 years. Is there any way to access his Social Security before the time that we are in our 60s? Or is that not an option at all until our 60s?
Yeah, for survivor benefits, it's 60 years old, unless there's that disabled widow's benefit. So you can collect benefits on the deceased's record. It's the disabled widow's benefits, and that's between the age of 50 and 59. So other than that, yeah, you have to wait till at least you're 60 years old. So. All right, that is it. We're over an hour, and I appreciate you all. I'll be back again tomorrow, and we have Ari from Chapter tomorrow is going to go through all kinds of Medicare type stuff, answer your questions. People always love it when Ari comes in, and so do I. He's awesome. He's really good to talk about all kinds of Medicare. So we'll do that tomorrow. And other than that, we'll see you all. Have a beautiful night, and please, 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 please take care of each other.